Assalamualaikum. We are from Group 5. We have 5 members, and here we are. I am Aqilla Bahira.
I'm Elva Oktaviani.
I'm Nessa Febriani.
Nora Siti Muawanah.
And I'm Putri Sari.
We will show a little explanation about tuberculosis. Okay, let's go!
What is tuberculosis? Tuberculosis is one of the potentially serious infectious diseases. This disease can occur in various organs of the body, but often attacks the lungs. Next, my friend will explain about
Causes. Tuberculosis is caused by infection with the germ of the same name, namely Mycobacterium tuberculosis. This germ or bacteria spread in the air through places of the patient's saliva, for example, when talking, coughing, or sneezing. However, the transmission of TB requires close and long contact with the patient, not as easy as the spread of the flu. Next, my friend will explain about signs and symptoms.
Thank you. Okay, next, signs and symptoms. Symptoms of TB disease depends on where in the body the TB bacteria are growing. TB bacteria usually grow in the lungs, pulmonary TB. TB disease in the lungs may cause symptoms such as 1. Bad cough that lasts 3 weeks or longer. 2. Pain in the chest, in the neck, the severe soft of breath. 3. Weakness, fatigue. 4. No appetite and weight loss. 5. Fever. Okay, next, my friend will explain about prevention.
Thanks, Nora. Next, we have preventions. If you have tuberculosis, the steps below are very useful to prevent transmission, especially to people who live with you. First, cover your mouth when you sneeze, cough, and laugh. Second, if you use the tissue to cover your mouth, throw it away immediately after use. And make sure the house has good air circulation. Next, how to prevent contracting TB for healthy people. First, avoid or limit close contact with people with tuberculosis. Second, if you live under the same roof and have to interact daily with sufferer or even need to care for them, it is important to use personal protective equipment, such as masks, and adopt a clean and healthy lifestyle. The last but not least, maintain an increased endurance, especially for the elderly who are susceptible to infectious disease. Okay, here Putri.
Okay, thank you Aqilla. And next, treatment of TB. For medical treatment, TB disease can be treated by taking several drugs for 6 to 9 months. Of the approved drugs, the first-line anti-TB agent that form the core of the treatment regimens are: first, isoniazid to inhibit the biosynthesis of mycolic acid, which has an important constituent in the mycobacterial cell wall. Second, rifampin to inhibit the synthesis of ribonucleic acid in the broad spectrum against pathogenic bacteria. And third, ethambutol to prevent or inhibit the emergence of resistant strains. And four, pyrazinamide. It acts as an antibiotic and works by stopping the growth of bacteria. Other medicine must be with a doctor's prescription. For non-medical treatment, there is no therapy other than drugs that can eliminate Mycobacterium tuberculosis bacteria from the body, whether with herbal plants, exercise, radiation, or certain ways that can make someone recover from the TB other than with existing drugs. With many people who are not disciplined about taking this drug, new type of bacteria that are resistant to the drug are starting to form. So, the drugs must be consumed longer and type is changed.
That's all. Thank you for your attention. Bye!
Bye!